All right, so today we're doing our ear examinations. Start off with ear examinations. I'd be just looking outside first, doing a little bit of observation, looking at her auricle, making sure that everything looks normal. There's no inflammation, no infection, or anything of that nature. I'd also be looking at her external ear canal, looking for the same thing: any discoloration, infection, arrhythmia, edema, anything out of the abnormal. I would then do two tests, one tug test and the other one pressing on the tragus. So the first one is a slight tug. Does that hurt at all?
Nope.
Okay, and then it's a little hard to do her tragus because she has an earring in it, but I'll give a little push down on the tragus. Does that hurt?
Nope.
No? Okay. Next thing I'm going to do is observe the inside of her ear. For this, I'm going to have to pull her ear superior back and a little out. Then I'm going to look inside of her ear. And yep, she has normal. She had a good cone of light. There's nothing wrong with the symphatic membrane that I could see for. She had a little bit of earwax in there, but that's normal, so nothing to be concerned with. I would then switch to the opposite side. And on the opposite side, I would repeat. So, start observing. Slight tug. Any pain with that?
Nope.
Push on tragus. Any pain with that?
Nope.
And then up, out, and look inside her ear. Same on this side, a little less earwax, but good cone of light and nothing wrong with the symphatic membrane that I could see. Next thing I'm going to do is then go to the back behind the patient. I'm going to press on her mastoids, ask her if she has any pain with that.
Nope.
That would be just looking to see if there's possibly any mastoiditis, but she tested positive for that. I'm going to do a bunch of hearing tests. So the first one I'm going to do is I'm going to flick this to get it to start ringing. I'm going to place it on top of her head. When I do this, I'm going to ask you if you can hear both and if it's equal on both sides.
Equal.
Equal?
Mm-hmm.
Okay, good. Next thing I'm going to do is kind of a rustling test. So for this, I'm going to just test to see how far away she can hear my fingers rustling. So can you hear that?
Mm-hmm.
Okay, now I want you to tell me when you can't hear it anymore.
Okay.
Okay. Now I'm going to come back in. And then tell me when you can start to hear it.
Okay.
Okay, about the same spot. We'll then repeat on this side. Tell me when you can't hear it anymore.
Okay.
Okay. Then I'm going to come out and tell me when you can start to hear it again.
Okay.
Good. So about equal on both sides. Next thing I'm going to do is then take my tuning fork again. This time when I make it ping, I'm going to put it on her mastoid and ask her if she can hear that. When she can no longer hear that, I'm then going to switch to the front just to see if she can hear it again. So tell me when you can't hear the ring anymore.
Okay.
Can you hear it again?
Mm-hmm.
Okay, good. I'm going to do the same on the opposite side.
Okay.
Can you hear again?
Yep.
Okay, good. Now, the last thing I'm going to do is I'm going to test my hearing with hers. So this is going to involve taking the tuning fork and sounding off on it. I'm then going to compare our hearing just for a time period to see if we have consistent hearing. So tell me if you can hear this.
Yep.
Still hear it?
Yep.
Okay. Then switch to the opposite side and do the same. You hear that?
Yep.
You hear that?
Yep.
Okay. So good. And that would conclude our ear examination.